Today we shall discuss our lecture about child health. At first, we have to give the importance of child health in our community, as children are the future productive group of the nation. First, child population represents a large sector of population. It varies from 1/3 to 1/2 of the total population. Children are one of the vulnerable groups as they undergo physical and mental development, which can easily be changed to pathological ones. In addition, children are more exposed to diseases related to infection and malnutrition, which may be associated with impaired health, disability, or handicapping obstacles. Children are also dependent individuals, so they need social security. Most diseases which cause morbidity and mortality in children are preventable, and preventable by primary level of prevention, as through health education, immunization, and environmental sanitation. Common health problems among infants and preschool children. As we mentioned before, children represent an important vulnerable group, particularly infants. What's meant by infant? I mean, it is the age of the first year of life. And preschool children also, those who aged 2 to 5 years. They are subjected to high mortality and morbidity rates. Mortality, including first, perinatal mortality, infant mortality, and preschool children deaths. By perinatal mortality, it is the number of fetal deaths from 28 weeks of gestation plus the number of deaths in the first week of life per 1,000 live births. It is influenced by the prematurity rate, in addition to causes of stillbirth, as intrauterine infection, obstetric complications, and general disease. Infant mortality rate, very, very important. It is the total number of deaths of infants below 1 year per 1,000 live births in certain year and locality. In Egypt, it is about 60 per 1,000 live births. However, this rate is taken as an index for two something. First, It is an index of the community development in general, and it is an index of maternal child health services in particular. What are the causes of infant mortality rate? The causes of infant mortality are classified into two categories. First, neonatal causes. Second, post-neonatal causes. The first neonatal causes include prematurity, by which is mean low birth weight and weighing 2,500 grams or less at birth, irrespective to duration of gestation, or low birth weight preterm infant, by which I mean newborn before the age of 36 weeks of gestation. First neonatal cause is prematurity, to be followed by major obstetric injuries as intracranial hemorrhage. Addition to infection as tetanus neonatorum and neonatal diarrhea, besides asphyxia neonatorum and congenital anomalies. The second group include post-neonatal causes as gastroenteritis, which cause dehydration and the other complications. Gastroenteritis is a disease of pollution. It is the main killer of infants in developing countries. It occurs as a primary disease by ingestion of contaminated food. Second, post-neonatal cause is respiratory disease, namely bronchopneumonia, pneumonia, bronchitis, and the bronchiolitis. These diseases may be primary cause of death or secondary to other debilitating ones. The last category include congenital anomalies and prematurity. What are factors affecting infant mortality? Two categories: social factors and biological factors. Social factors including low socio-economic standard, bad housing condition, and ignorance. These three groups were found to be in association with high infant mortality, as low socio-economic and bad housing condition and the ignorance, when found, the infant mortality is increased. Second, biological factors as age of mother at conception, particularly those aged less than 20 years, also enter pregnancy space, particularly if it is found less than 18 months. ويقول القرآن في هذا الصدد وفصاله وفطامه في عامين. وفي موضع آخر والوالدات يرضعن أولادهن حولين كاملين لمن أراد أن يتم الرضاعة. Also parity as a biological factor affecting the infant mortality rate, it was found it is high in the first one and fifth one or more. يبقى also multiple pregnancy will affect infant mortality rate. Finally, medical conditions during the pregnancy, whether general disease or complications of pregnancy. Preschool children mortality rate. It is the total number of deaths of preschool children aged 1 to 5 years per 1,000 of children of the same age group in certain year and locality. It is the highest during the second year of life, followed by the third year, and is lowest during the fourth and fifth year of life. Preschool children mortality is caused mainly by gastroenteritis, bronchopneumonia, and bronchitis, besides the accidents and the heart diseases. Second, morbidity. As we mentioned, two, mortality and the morbidity. The morbidity will include communicable diseases, malnourished disease, prematurity, post-maturity, and accidents. Regarding the communicable diseases, they are classified into congenital infection, neonatal infection, and the post-neonatal infection. Regarding the congenital infection, they are transmitted in utero or transplacentally as rubella, toxoplasmosis, AIDS, syphilis, and the other viral infections. This category of disease may lead to abortion, congenital malformation, or end by congenital diseases. Secondly, neonatal infection. Newborn infants has naturally acquired the passive immunity from mothers against diseases to which the mother is already immune. Examples for this category include measles, poliomyelitis, and diphtheria, but not acquiring immunity against pulmonary tuberculosis and whooping cough. Thirdly, post-neonatal infection. As infections are the major cause of death among infants and preschool children. Children less than 5 years suffer from 3 attacks of acute diarrhea and 5 episodes of acute respiratory tract infections yearly. However, acute respiratory infections and diarrhea are leading causes of death of young children and account for more than 25%. Secondly, malnourishment. The common nutritional problems include protein energy malnutrition diseases, of prime importance of which are marasmus and kwashiorkor. Secondly, iron deficiency anemia. Thirdly, vitamin deficiency, including rickets, vitamin A deficiency, and the multivitamin deficiency. All malnourished diseases are caused by inadequate supply of food necessary for feeding of children, besides bad feeding habits, and weaning. Also, they are caused by repeated attacks of gastroenteritis. It is aggravated by parasitic infection, especially in low socioeconomic communities. Malnourishment in early life affects the physical growth and is considered as a risk factor for mortality from infectious diseases. Moreover, severe prolonged malnutrition in the first 2 years of life may be associated with retarded brain growth and mental development. Thirdly, prematurity, which is a very, very important question in all exams. Prematurity. What's meant by prematurity? What are the etiological or predisposing factors of prematurity? What are health hazards of prematurity? How to manage prematurity? So it is very, very important. By prematurity is mean either low birth weight infants weighing 2,500 grams or less at birth, respective to duration of gestation, and or preterm infant, by which is mean infant born before 36 weeks of gestation. Etiological or predisposing factor, either intrauterine infection, as I mentioned before, infection acquired intrauterine or through transplacental, by which the infant acquire immunity against certain diseases to which his mother is immune, as measles, poliomyelitis, and diphtheria, and not against TB and whooping cough. Second, maternal factors, as in age, where the young mother, particularly if she is less than 20 years age, she is physiologically immature and they may not continue pregnancy to term. Also, low socioeconomic standards, as it was found that those with low socioeconomic standards suffer greatly from prematurity. Also, previous history of abortion or premature delivery will affect infant prematurity. Height of mother less than, if the mother is less than 150 cc. Also, some habits may affect prematurity, and these include maternal smoking, alcoholism, drug addiction or psychoactive drug abuse. Besides, associated diseases with pregnancy, including anemia, cardiac disease, urinary tract infection, bronchial asthma, and hypertension. Finally, obstetric complications, including preeclampsia and the antepartum hemorrhage, malpresentation, and multiple births, in addition to polyhydramnios and premature rupture of membranes. Health hazards of prematurity, very, very important. Prematurity will create a lot of health hazards, including malnutrition. This may be attributed to poor suckling, poor digestion, and immature liver, the most important of which are rickets and anemia. Second, impaired regulation of body temperature, which may be associated with tendency to excessive heat loss. Thirdly, increased infection, particularly respiratory infections and gastroenteritis, which are attributed to diminished resistance and the high susceptibility to infection. Mortality is high mainly due to intracranial hemorrhage and pulmonary infection. In addition, other hazards are as impaired mental development, including kernicterus, hemorrhage, and birth injuries. Management of prematurity. It will depend upon establishment and the maintenance of respiration. Secondly, prevention of infection by sterilization of air, dressing of umbilical cord and all articles used. In addition to, personnel must be free from infection, wearing sterile masks and gloves, in addition to minimal handling. Finally, prevention of infection will be conducted by applying chemoprophylaxis, which are drugs given either before or immediately after exposure to infection to prevent infection. Thirdly, regulation of body temperature. This can be conducted either by using the incubator or wrapping in cotton and blankets. Finally, special feeding system and supportive therapy, whether oral vitamin and iron and parenteral vitamin. Post-maturity. Post-term infant is a newborn infant born after 40 weeks of gestation. It is dangerous to fetus because of placental insufficiency, anoxia, and abnormal neurological signs in the newborn infant. The most important examples are cerebral palsy and spastic diplegia, which are more common among the post-mature infant. However, its prevention mainly is by proper antenatal and natal care. I mean through primary prevention. Primary prevention is a tool of prevention used for preventing post-maturity, which is dangerous. Finally, accidents. They are mainly home accidents, as foreign body inhalation, burns, chemical poisoning by potassium insecticides, and drugs, in addition to drowning. The causes of accident among children include overactivity of young children, together with their curiosity and eagerness to explore the surrounding environment. These are considered as predisposing factor for occurrence of accident. Generally, the accidents, whether indoor or outdoor, have a risk of death, disability, and crippling among children.